Thank you very much for subscribing. If you haven't subscribed, do subscribe and hit the bell icon for instant upload notification. In this video, we are going to play with the action potential and their drugs. Especially in this video, we will learn about the action potential and their phases, and in the next video we will be learning about the anti-arrhythmic drugs. Okay, come on, let's start. Here, in each of our cell there is one main pump, that is sodium potassium ATPase. Okay, so this sodium potassium ATPase function is 3 sodium goes out and 2 potassium come in, and due to the action of the sodium potassium ATPase, the membrane inside the cell is negatively charged and the membrane outside the cell is positively charged. Okay, I think it is clear. And due to the sodium potassium ATPase, we have a resting membrane potential of -90 millivolts. So this -90 is mainly due to the sodium potassium ATPase. Now we are at resting phase. What happens? You are very fond of the junk food. So you get a Lay's packet and you start eating the Lay's. So now after you start eating the Lay's has more of the sodium content. Due to this, when you start eating the Lay's, the sodium ions come into your cell. So it comes into the cell. Now after the resting membrane potential, after resting, your cells become active. See, your cell starts to depolarize. In one word to say, until you complete eating the Lay's, your cell starts to depolarize the cell. Now we are in depolarization phase. So the depolarization is due to the influx of the sodium ions. So it is due to the eating of the Lay's, in another way if you want to remember. Now what happened? After some time, your mother came into a room. She shouted at you like, why are you always fond of junk food? Eat like healthy food also. So later what happens? She scolds you and tells to eat the banana, which is available right away, but you are absolutely not fond of bananas. So what you do? You don't eat bananas, but the bananas are rich in potassium. So if you don't eat banana, you don't get enough potassium to your body. So your cell wants to donate the potassium into the blood. So when your cell tries to donate the potassium ions go out. So at this point, after your Lay's is completed, now as you don't eat the banana, so your potassium ions are effluxed or going out of the cell. Due to this, repolarization has started. I think it is clear. So due to this, the one phase which is in the red color, this is the repolarization. Now the repolarization has started. After some time, what happens? You again start craving for pizza, like anything. So now you get a pizza and you start eating. Pizza is more of cheese. So in cheese, there is more of the calcium content. So when you start eating the pizza, there is an influx of the calcium ions. So into the cell, the calcium ions go or come. So when calcium is coming inside and potassium is still going outside, because you still didn't eat banana. So due to these potassium and calcium balance, you have a steady state. You have a straight line. After some time, your pizza is completed, even though you didn't start eating banana. So your repolarization or your potassium channels become maintained, like it keeps opened. So now that repolarization has completed, and again we reached the resting membrane potential. A quick recap. The first point you have to remember, resting membrane potential is because of sodium potassium ATPase. And after this, what happened? You started eating Lay's. So when you started eating the Lay's, what happened? So the cell started to depolarize. So when the cell started to depolarize, there is an influx of the sodium channels. And after completing the Lay's packet, you didn't eat the banana, so potassium efflux started. And due to this, repolarization has started. After that, you started to eat the pizza. So when you started to eat pizza, the influx of the calcium and the efflux of the potassium has balanced, and that is why you have a steady state. So this is the steady state. And even after completing the pizza, you didn't like banana and you didn't eat, and that's why your potassium channels keep opened and there is more of the repolarization. And now the repolarization is completed and we achieved the resting potential, like resting membrane potential. After this, what happens? This duration which is from here and up to here. This entire duration is known as the action potential duration. This is known as APD. So this APD, we can observe it on the ECG like I am explaining here. You know, this is the main ECG, basic ECG, the P wave atrial depolarization, the QRS ventricular depolarization, and later it is the T wave tells you about the ventricular repolarization. Now what happened on the ECG, we can easily tell you like from the Q wave up to the T wave. What is this? It is the start of the ventricular depolarization, and after that ventricular repolarization is completed. So T is the ventricular repolarization, so this is the R, and this is the D, ventricular depolarization. So D plus R, this entire time duration is QT interval. Am I right? So this is QT interval. This is what exactly we know here as action potential duration. So action potential duration is nothing but the QT interval on the ECG. So when you observe the QT interval on the ECG, that tells you that your action potential is normal or abnormal. So if it is abnormal, there is a chance of arrhythmia. If it is normal, your rhythm is normal. Okay, this is what about the action potential duration. After eating junk food for many months, I became very fat, and now I decided to avoid all the junk food. So now I try to block everything. I try to block the Lays, that means I try to block the sodium channels, and I try to block the pizza, that means I try to block the calcium channels. Okay, and later what happens, the banana, as I am not fond of it, I try to block it also. Now not fond of the junk food, now I think okay, it's maybe banana is good for health. Sometimes I try to eat banana. So we discuss about the potassium channel openers and potassium channel blockers also. So two types here, but Lays and pizza strictly avoided. Banana depends upon my wish, so I may open it or I may block it. Okay, so this is main drugs. How do you remember that? That is, outside the cell we have more sodium, inside the cell we have potassium rich, and this is beta receptor, and this is the endoplasmic reticulum, which is rich in calcium. So according to Wagon-Williams classification, we mainly have 5 classes of anti-arrhythmic drugs, that is 1, 2, 3, 4, 5. So the first is sodium, second is beta sodium, first one is sodium blocker and second one is beta blockers, third potassium blockers, fourth is calcium channel blockers, and the fifth is others like miscellaneous drugs. How can you remember this classification? It is easy. Like the first one, come from outside to inside. The first you block sodium, and later you block the receptor, the beta blocker, and third you block the potassium, and you go deep inside and block the calcium. So 1, 2, 3, 4. So this is how you can remember the classification, and class 1 tells you it blocks sodium, class 2 tells you that it blocks the beta, class 3 tells you about the potassium channel blockers, and 4 for the calcium channel blockers. Okay, now what happened? Now we are trying to block the sodium channels. That is the first thing, you are trying to avoid the Lays. So when you try to avoid the Lays, this slope will not be straight as the first in the first image. It becomes slant. So from here it bends like this. What happens? There is a decrease in the slope. This is because you are blocking the sodium channel. Why there is a decrease in the slope? At resting membrane potential here at minus 90 millivolts, you ate Lays. That's why there is an immediate start of the depolarization, as there was immediate influx of the sodium channel. But you are blocking the sodium channel, and that is why to reach the more positive membrane potential it takes more time, and that is why the graph will be slant. So after you block the sodium, now what happens? Even you block the calcium channels also. So now if you block the calcium channels, and later if you block the bananas also, if you block the potassium channels also, this action potential will increase. Okay, just a second. From here, this was due to the sodium channel blockers. And when you are trying to block the potassium channels also, what happens? There will be an increase in the action potential duration. You can observe in this image that from here up to here, what happened? This is the action potential duration. So here it is, action potential is increased because of blocking the potassium channels. If your potassium channel is blocked, this repolarization which is occurring in the green one, this repolarization will be slowed down. Due to this, there will be an increase in the action potential duration. So what you have to understand, if there is an increase in the action potential duration, then there is an increase in the QT interval. Am I right? Yeah, exactly. As I have drawn here, when the QT interval rises, that indicates there is an increase in the action potential. So when you block the potassium, your action potential duration increases, your QT interval increases in the graph. So you must understand that. And when you open the potassium channel, what happens? Then the action potential duration will be decreased. Like the potassium will be here. The repolarization occurs very quick, and due to this, your action potential duration will be decreased. Am I right? Yeah, this is all you have to remember about the arrhythmias and the main action potential. So what we have left with, we have to discuss each of these classes, class 1, 2, 3, 4, 5, and their drugs which are included here. So I think now that you have understood the classification, and also you have understood how we are going to block each of the phase in the action potential. So this phase 0 is due to the sodium channel influx, and this is the depolarization. And later we have the repolarization phase, but it is not in one single waveform. We have two waveforms. First, due to the potassium channel opener, we have this phase, and later due to the efflux of the potassium and influx of the calcium, there is a steady phase, and later the repolarization is completed. And if potassium channel is opened at resting membrane, there will be hyperpolarization. If potassium channel is opened at depolarization, there is a repolarization. If you like the video, kindly hit the like button, and if you have any suggestions, feel free to comment below. If you want to join any of the Telegram, WhatsApp or social media networks, find the link in the description provided. Thank you for watching.